So let's address the elephant in the room, my hair. So if you've not seen my TikToks for like the last week, you may not have known that I got a hair transplant. And some of you may be wondering, well, why, Damien, why would you get a hair transplant when you seem to have had hair? But it was more about the quality of that hair and the density of it, and more importantly, how much longer I'd be able to actually hold on to that hair. So we'll start at the beginning. I first noticed that my hairline was receding and my hair was thinning when I was about 18. And by 25, I'd seen significant changes in my hair, from my hairline to my crown balding, my hair thinning. So I went and was prescribed finasteride, which is a medication which helps reduce hair loss and in some cases even stimulates hair growth. I took that for about a year, almost 2 years, and didn't really see the results that I wanted. So that's when I knew that I really wanted a hair transplant. So now at 31, I was spending much more time styling my hair in ways that was disguising my baldness and hiding my bald patches, and it was taking a huge toll on my confidence, on my self-esteem, and more importantly, taking a huge toll on my mental health, as this is something that I was thinking about every single day, and it became one of the main reasons why I became a lover of hats. So when the opportunity came along to do something about it, I took it. I contacted the guys in Hairvana, and it was only just such a breeze. I could speak to the doctor directly in English. She also speaks Spanish. I could speak with George, who's the UK rep, and we got the ball rolling. So just as simple as over WhatsApp, sent the guys a few photos of my hair, told them what my issues was, my hairline, my crown, and more importantly, pictures of the back of my head, which is called the donor area. So the donor area is important because this is where they're going to pull the follicles from to reimplant them in the front. So if you don't have a good enough donor area, you may not be eligible for a transplant in the first place. So we set a date and I booked a flight. So I flew to Istanbul via Turkish Airways. I landed in Istanbul at 11:30 p.m. local time, where I was met by a driver. Yes, I even had a driver. I arrived at my hotel, this huge, beautiful 5-star hotel that had a pool, a gym, a spa, the works. Obviously the restaurant was closed as it was past midnight, but I was able to order room service. Then the next morning, my driver, still sounds weird saying that, picked me up and we headed to the clinic, which is located inside a huge state-of-the-art hospital in Istanbul. I was greeted by Betty, who is one of the doctor's assistants. Betty is an interpreter for the clinic, and she helps guide the patients through the hospital, and is also able to translate for the patient if they don't speak English or if they don't speak Spanish. So we then went and got a blood test to make sure that everything is all good and that I'm in good healthy shape to have surgery essentially. We went for a coffee and a snack while we waited for the bloods to come back, and then we headed up and had our consultation. So a long in-depth consultation all about the procedure itself, what to expect, what I need to do afterwards, and also to find out how many grafts that we would need to take. So luckily I have a good donor area, which meant we were able to take quite a few grafts, and also meant that we could fix the density issues in the crown and coming forward, but also able to bring the hairline back forward to where it used to be when I was about 16. So then we go in for the grafts. So you lay face down on the table, and they apply some anaesthetic to the back of your head. Getting the actual anaesthetic done is probably the most uncomfortable part of the entire procedure, but you go numb very quickly, and the machine they use to take the grafts has kind of a white noise kind of quality to it. So if you like white noise and it helps you sleep, like I do, you will fall asleep. I fell asleep through the graft process, so I couldn't even tell you how long it actually took to take the grafts, because I fell asleep, which is amazing. So then I was woken up and we went for a bit of dinner. So all the doctors went and had a bit of dinner. I was brought dinner, which we ate, and then we got to implanting. The implanting part is definitely not as comfortable as getting the grafts taken. I definitely wasn't falling asleep through this part of the surgery. I wouldn't say it's painful, but I definitely wouldn't say it's comfortable. So I'd recommend some music or a podcast to try distract yourself, or have something else to focus on. So once you finish up, they give you a nice, cool, trendy headband to put on your head. This helps with the compression and the swelling. Then you're on your way. So my car arrived, brought me back to my hotel. I once again ordered some room service and went to bed. Now you may be thinking to yourself, how do you sleep right after getting a hair transplant? And I'll get to that at the end of the video. So the following morning, the car picked me up again as I returned to the clinic for a post-op checkup. This was to remove the dressings, and so the doctors could really examine the area, make sure that the donor area is healing up nice and well, and that the transplanted area is looking as well as it can. And just make sure that there's no signs of infections and that you haven't rejected the transplant in any way. Just your general post-op checkup. This visit is very short and quick, considering everything is all good. In my case, it was. The guys were absolutely delighted with how the transplant looks, how the donor area looks. I was handed my medication and was asked very simply, would I like to go back to the hotel to chill out, or would I like to go into Istanbul city and explore? So obviously I went and became a tourist for the day. So I got to see some beautiful tourist spots, like, you know, huge big mosques and markets that are much bigger than anything I've ever seen or experienced in my life. After that, I got a taxi back to the hotel. Once again, ordered more room service. Cracked on a film on Netflix and went to sleep. So the Sunday morning. So normally you would head back to the clinic to do your first wash. But my flight was at 1 p.m, so Norma, the doctor, and one of her assistants came to my hotel to aid me in washing my head for the first time. More so to show me the actual process, as I would need to repeat this process for the following 8 to 10 days. I'm now 9 days post-op. My donor area is pretty much completely healed. You can hardly even see where the grafts were taken. All the scabs from the implanted area had softened up and they've actually fell away naturally. And now it just looks like I have a shaved head. But now we have to be patient and we have to wait for it to grow. So now your burning questions. So one of the main questions that I get is, how much did it cost and what type of transplant? So the procedure that I got cost €2,950. This includes the VIP transfers between airport, hotel and clinic. It also included the 3-night stay in a 5-star hotel with breakfast, and also included the post-op medication, post-op wash, and of course the procedure itself. It just did not include the flight. And the type of transplant I got was a DHI, so it's direct hair implantation. How many grafts did they take? They took 3,600 grafts from the back of my head and reimplanted them in the front. So are you on medication? So there's a range of medication that we take right after the surgery. So there's medication that will be ongoing and medication that is just for after the surgery. For example, we take finasteride and minoxidil. This is to reduce any hair loss for the hair that we already had. It also helps the transplanted areas grow and is really gonna like help that density. So this medication and the hair transplant work hand in hand together. It's kind of like having a car. You can have the fanciest wheels in the world, but if you don't put petrol in it, it's not going to go anywhere. So the two things need to work in conjunction with each other. Now this medication is ongoing. You can take breaks from it, but essentially you will need to take it for the foreseeable. The other medication that you will take is purely post-op medication, so you'll be given some painkillers, because you will be a little bit sore for the next maybe 4 days after the actual surgery. You'll get an anti-inflammatory, which helps reduce the swelling. You'll get an antibiotic, which obviously helps reduce the risk of infection. Did it hurt? So as a whole, I would say no. I would say it's not really sore, it's just more uncomfortable. Getting the anesthetic injection is probably the worst part of the entire procedure. Other than the procedure being long, I wouldn't say it's painless, but I wouldn't say it's painful. It's a little bit uncomfortable, but it's definitely bearable. If you have some headphones, not headphones, earphones, a podcast, some music, you'll definitely get through it with a breeze. So why did I choose this clinic? Why did I choose Hairvana out of, you know, the many other clinics that are in Istanbul? The main reason I chose them, as I said earlier on in the video, was the ease of communication. Just being able to speak directly to the doctor in my own language And have that line of communication be so clear and so easy was one of the main reasons for going with them. It really helped me build a relationship with the guys, build a trust, because you're traveling to a whole other country to get surgery done. So clear, easy communication and trust were two really big factors for me. Is it permanent? So yes, as long as you're not abusing your body with drugs or alcohol and you're taking the medication if you're advised to do so, then yes, it's permanent. So as I touched on earlier on, how do you sleep with the transplant? So you get a nice branded travel pillow. So essentially, like you would on a plane, the travel pillow keeps your crown off of your actual bedding pillow, but it also doesn't allow you to sleep on your side. So it's kind of immobilizing your head a bit and isolating your donor area and your transplanted area, meaning that it's kind of hovering in space for at least a week ish to allow it to just heal, and it means that you're not going to potentially damage the transplanted area. Last but not least, like, was it worth it? I would say 100% yes. I actually wish that I'd done it sooner. When I was in the clinic and they shaved my head to get ready for the operation, and they shaved the side and you could see the stubble, and then when they shaved the top and I just saw skin, it was at that moment I knew that I was in the right place doing the right thing. I instantly knew that this was the right decision that I was making. This was something that was affecting me on a daily basis, and I'm so glad that I done the surgery. And even now, just knowing that I have the options, I know where my hairline is going to be. So like, I mean, I can have a buzz cut and I know I'm going to be okay with it. I know that I can grow it out to the way it used to be, and I know I'll have a better hairline and I'll have better density, so it's going to look better than it ever was. And I also know that I'll be able to grow it out longer than I ever was, because I'll have the density and I'll have the hairline to do that. If you have any questions, particularly if you follow me on TikTok, you'll know that I do my absolute best to respond to every single comment that I get, even on TikTok, that is. So if you know me, you know that I respond to every single message and every single comment that I get. So if you do have any questions that I didn't answer in this video, do not hesitate to shoot them in a comment below. Shoot me a DM on Instagram. More than happy to get back and chat to you. If you want to get in touch with the guys at Hairvana, I will leave George's contact details in the description of this video. Be sure to tell him that I sent you. You can WhatsApp George and he will give you essentially an over the phone consultation. He'll ask for photos of your hair, or what your concerns are, all that sort of thing, and they'll even be able to give you like a quote, so you'll know like a ballpark figure of how expensive your transplant is going to be and how much area needs to be covered, and more importantly, if you're actually eligible for a hair transplant in the first place, depending on your donor area. So I really hope that answers your questions. And before I sign off this video, I know Norma and her team are going to watch this back, so I just want to say a huge thank you to Norma, you and your team. This has been absolutely life changing for me. I'm only a week out from the op, and I can already see such a difference, and it's already affecting my confidence and my self esteem so much. I'm already a confident guy, and this is probably going to give me an ego complex. I just want to say, from the moment I landed in Istanbul, I felt like I was taken under a wing and that I was guided through the country, the process. I was shown around the city. I was completely embraced as a member of your family, and I just want to say a huge thank you for not only looking after me the way you did while I was there, but also for changing my life and giving me my hair back, and the care that I was given while I was there, and even the communication beforehand and the communication afterwards. It's just been absolutely second to none, and I'm so happy that I went and got the procedure done, and I'm even more happy that I went and got it done with you guys in your clinic in Hairvana. It really was probably one of the best decisions that I've ever made in my adult life. So I just want to say thank you. And now to sign off, as I said, if you have any questions at all regarding the hair transplant, if you're thinking about getting one, if even if you haven't actually thought about it, if your hair and your hair thinning or receding is something that you think about every single day, if it's something that concerns you every single day, just contact the guys and just have a little quick consultation over the phone. And this is something that is like it's relatively inexpensive, like just under £3,000, like €2,950 is very affordable, in comparison to what you would get quoted here in Ireland at least. So just give the guys a bell if it's something that you think about on the daily. I couldn't recommend it more. And until I see you in the next video, remember to be kind, stay classy, and be unapologetically yourself.